The administrative court will include a panel of 7 independent experts, 3 legal experts, 3 medical experts, and 1 citizen advocate who will serve as chairperson. They will be tasked with making a determination about each case. If either party is unhappy with the decision of the administrative court, access to the traditional state court route will be available. Dr. Kinsing is out front. However, a party appealing a decision of the administrative health court will have to agree to pay the costs associated with defending the appeal in the event that the appeal fails in state court. Administrative health courts will lower health care costs by reducing malpractice premiums, eliminating the tens of billions of dollars that patients and insurance companies pay due to defensive medicine, and saving taxpayers millions of dollars by removing frivolous lawsuits from state judicial systems. Desperately needed tort reform on this or any level is something that my opponent, Senator Dick Durbin, is completely unwilling to even discuss. Finally, no discussion of health care reform would be complete without addressing rampant Medicare and Medicaid fraud. Under my plan, we will create a Medicare and Medicaid fraud task force housed in the Federal Bureau of Investigations, consisting of FBI agents and local law enforcement officials, to crack down on the Medicare and Medicaid fraud cartels that cost taxpayers tens of billions of dollars each year. Fraud and abuse in the Medicare and Medicaid systems constitute a serious and growing problem, and one that adds to the overall costs and inefficiency in our healthcare system. The Your Healthcare, Your Choice plan calls for tough punishment for those who abuse the system, including mandatory one-strike and you're-out sentences for those found guilty of Medicare or Medicaid fraud. In addition, my plan will encourage states to crack down on fraud in their own Medicaid systems by offering states the ability to keep half of all dollars that are recovered as a result of elimination of fraud. My plan will also provide for mandatory prison sentences for those guilty of Medicaid and Medicare fraud. Now is the time for real change. Dick Durbin has had his chance, and the disastrous results speak for themselves. Unlike Dick Durbin, I offer more than just empty election year rhetoric. I offer a wealth of real-world experience in the healthcare arena, and I offer real solutions that will end our healthcare crisis. People today are overwhelmed. They are overwhelmed with their work, with raising their families, with struggling to make ends meet. I hear it in my practice every single day. The bottom line is that we need a healthcare system that makes facing illness or injury simpler. We need a healthcare system that helps make life just a little bit easier for the folks who are accessing it, folks who are often accessing our healthcare system during trying times for themselves or their families. Working together, we can make that happen. Thank you very much. Sir.
You talked about wanting to eliminate bureaucracy. This administrative health plan, doesn't that add a layer of bureaucracy and put people's fate in the hands of, again, nameless, faceless people as opposed to you or your peers?
Well, no, I don't think so. I think the reality of it is that right now the plaintiffs are not served well by this judicial system. Neither are the defendants, neither are the public. The only ones being served well by the system currently are the attorneys. The remedies in the state court systems are taking up to 5 to 10 years to complete. So even if you have damages and a legitimate reason for a lawsuit, you can expect to spend years on this and then to get a fairly random decision as a plaintiff. So this is not a good system for plaintiffs. It doesn't work. It doesn't improve the quality of health care. It doesn't provide plaintiffs with a reasonable, timely remedy for their concerns, and it certainly doesn't serve doctors well. So this system fails virtually everyone, and that's why I want to change it.
How long do you expect it to take with the panel of experts that you're discussing?
I've seen cases that will take 2 hours. I mean, some of these cases that we see in the judicial system regarding medicine are so straightforward and so abusive, they could actually be taken care of in a matter of a few hours instead of a few years at a minimum. And this is obviously a huge decrease in the amount of bureaucracy and cost. And plus, everybody will get the feeling that they're treated fairly in a prompt manner. And so I think this is a dramatic change, and I understand it's a dramatic change, but I think it's in the best interest of all parties except the attorneys.
You say that government-run medicine is going to destroy quality health care in America. But the problems we're facing right now are the result of a private sector health insurance market that has gotten us to this place.
I don't agree with that at all. This is not a private-run system. This is a system where the controls are all set by the government. Every payment is tied to, virtually every payment is tied to Medicare in some way or another. And so the revenue stream is controlled by the government. In essence, that is not a free market system. And, you know, what percentage of the people now in this country are in some kind of government subsidized program? That's a huge number. And so this is not a private free market system in any way, shape, or form anymore. And it needs to be. We need to instill competition in this thing and some free thinking and some new thoughts, because what we have is stagnant and it doesn't work and it's dissolving right before our very eyes. And we cannot continue in this vein.
And it's going to be easier for people to wade through hundreds of possible health insurance programs, policies, and make their own decision rather than the system they have now where they can obtain it through an employer or whatever.
Well, I don't think it has to be hundreds. I think it can be 5. I think it can be 10. You know, in a free market system, consumers tend to get what they want. And hopefully they will get understandable, affordable, reasonable health care plans that they can understand. Because let's face it, nobody understands their health care plan. You know, recently we had an experience in my family where we needed health care, and I'm sorry, I'm the doctor and the businessman, and I have trouble following the garbage they sent me as bills, and this is covered and that's not covered, and this is covered this much, and this is what you owe. No, this is what you owe. It's a nightmare. Can't we make people's lives a little easier? Life is hard. Life is complicated. Our healthcare system does not make it any better. It makes it worse. There has to be another answer to this.
How do you ensure that you said you would prohibit an insurance company from denying coverage to someone with pre-existing condition, but how do you ensure that a company will provide affordable insurance to someone with those kind of conditions?
By reducing the costs. I mean, insurance companies got to get in this business. There's going to be competition. And what we have to do is do the right thing so that we don't have so much waste in the system. I mean, we're spending 50% more than almost any other healthcare system in the world, and our outcomes are no better. We are no healthier. And that seems ridiculous. If we're going to spend 50% more, we should be the healthiest crew in the world, and we're not. There is waste in this system. There is tons of it. It needs to be rooted out and eliminated so that we can function. I mean, this affects every aspect of our lives. This affects business. This affects our ability to keep jobs in this country. This is a huge deal that we need to deal with, I think, pretty promptly here before this thing gets worse.